My name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts and topics in nutrition, prevention, integrative medicine for the individual, society, and the whole. And I was just accumulating the data, what topic I was going to write about. I was thinking about cancer because I have several cancer patients, and I've treated myself for cancer, and then all of a sudden on the news. Uh, President Biden is said to have an aggressive form of prostate cancer. It kind of came on suddenly, though that's questionable. And so I was listening to somebody from a political perspective saying how maybe they kept it quiet. And it's been there a long time, and that's affected a variety of aspects of his health. But being in the business that I'm in and reviewing so many articles on the COVID-19 vaccine as part of uh, as part of what I do and treat, you know, vaccine injury, long haul COVID. Um, the first thing I thought about really was I know this guy had multiple vaccines. And so I went and Googled and hit AI, and I hope it's right because the number I got was actually six the first time. He said six COVID boosters starting off in December of 2020. And then 2021 was the first 1-2 series. And then he's had a booster ever since all the way through September of 23. So there's a question whether it's five or six. Because I hit AI and it says at least five, but I can count six on the date. So I'm not sure. But in that time frame, uh, in studying and talking to a lot of physicians, traditional physicians who treated early COVID and long haul COVID, they tend to be the people who use repurposed drugs in treating cancers. And I'm very familiar with the use of repurposed drugs in cancer since I've treated myself with them. And so, one of the topics that comes up is the COVID-19 vaccine. And the COVID-19 vaccine, we know the spike protein has cardiotoxic type effects. I've heard neurologists say that there's a rapid increase in neurodegeneration. So we look at Biden for that. The progression through his 4 years and 4 or 5 years now. And then we look at what are called turbo cancers, more cancers coming on quicker, younger, and doing more damage faster. So, I mean, you have the president, he had COVID three times at least, that's what AI said, and he had at least five vaccines, and I counted six. And if we look prior to him getting into office the very first time, I remember seeing montages of him, and I do the administer the MOCA test or the Montreal Cognitive Assessment Test. And I would have been very surprised even before he got into office if he wasn't in mild to moderate cognitive decline. I've done a lot of these kind of tests. So we know we saw the decline during COVID or doing his 4 years. And even though it was, they say, they try to cover it up. I think a lot of people are backpedaling right now, but we obviously saw it accelerate. Now, the question is, could the COVID vaccines, because he's had at least five or six, could they have sped up both the cancer and could they have sped up his cognitive decline? And my guess is yes. Now, that's just a guess. And the reason I bring it up is because I think of many times, what is the most preventive thing I can do? I sit in front of a patient and I talk to them about nutrition and diet and lifestyle. But what is the most preventive thing I can do? And right now, I keep coming back to, and that's probably why I write so much and glean so much work on cancer, is that it's the prevention of getting the vaccine. The vaccine, there's no need to take it, even if, well, there's no need to take it because it doesn't prevent COVID. It doesn't prevent you from getting it or transmitting it. And we don't have any double blind studies showing that it, reduced hospitalizations. And so as that debate rages, there's like two worlds. And I spend a lot of time reading very smart formerly traditional medical people from all specialties, bringing the concerns about the COVID vaccine with regards to cancer, with regards to cognitive decline, with regards to cardiovascular toxicity. So I think that's possible, and we'll just see how this pans out with former President Biden. But he's got a challenge, because if in fact the vaccines do enhance oncogenesis, as many very smart people think, he's got that to deal with, and also his cognitive decline. So uh, I wish him the best, and actually, interestingly enough, that's kind of, I don't know, use the word karma, but the drugs that might help him the most are the ones he might have made fun of, or at least his administration, and that's ivermectin and fenbendazole and mebendazole, the parasitic drugs. And interestingly enough, if he goes on anti-androgen therapy, they talked about hormone therapy, that's going to suppress whatever testosterone he's got left. And that could accelerate his cognitive decline. I mean, I've seen many people go through it. It's not fun when you're suppressing your testosterone levels, and testosterone is very important for cognition. So it could be a rough road, and an alternative road would be to use ivermectin and or mebendazole or febendazole along with some other nutraceuticals, which brings me to the point of how I might approach cancer patients. But first is, I try and get people. I follow a lot of William Mackis, MD. He's a Canadian radiation oncologist, and he has a very good service. I encourage all my cancer patients to get his newsletter, pay for his newsletter, because then you can see over and over different cases. I mean, it's mind-boggling how much work he gets done. But I mean, I see, it seems like 5 or 10 cases a week, and he gives dosages of a wide variety of cancers responding. And the big kind of theme is there's an ivermectin combination with either mebendazole or febendazole, and the ivermectin is usually at a 1 to 2 milligram, 1 milligram to 2 milligram per kilogram dose, and you taper it up. I start people at a 0.5 milligram per kilogram. Another week, go up to 1 milligram per kilogram and increase up to 2 if it's a significant cancer. So that's something very simple. And then when I look at the mebendazole and fenbendazole doses, they're usually in the broad cancers, somewhere between 1,000 and 2,000 milligrams per day. Though fenbendazole makes my liver enzymes go up. So it can make a person's go up. So if you're on fenbendazole, you should not just take alpha lipoic acid or silymarin, but you should get screened every couple of weeks for liver function. And then there's the excellent book, if we want to get into more things, not just those two repurposed drugs, because there is more than that. I highly recommend Paul Merrick's book, the cancer cure, or cancer care, excuse me, cancer care, the role of repurposed drugs. He does an outstanding job at reviewing a large material and making it palatable and usable in it's actually for free. You can download it from the internet now at I'll have to say it's the Independent Medical Alliance. And you go to imahealth.org, and you just look for education and cancer care, and that'll help you out. And that's a fabulous book. Everybody should read that. So I always encourage my patients to do that. I encourage them to get the Mackis newsletter, and I encourage them to get an appointment with Dr. Mackis. He comes out with a very simple protocol sheet that has protocols for the cancer, and then it has frequently asked questions of all the drugs in 2 or 3 pages. Very, very good. And then he has a resource page that people can go to where you get those things. So I encourage everybody to do that. And by that time, if they come see me, then we do IV vitamin C. I help coach them around how to put all this stuff together, because it's hard. And then diet's the big one. So Dr. Thomas Seyfried, a geneticist, really championed the ketogenic diet, and the theory is that cancer cells work off fermentation to produce energy, so they thrive on sugar and glutamine. And so definitely cutting out all processed carbohydrates is very, very important in cancer treatment. Whether or not you can stay in ketosis or not, I couldn't do it. All right, I lost a ton of weight. And that was probably the only thing that I didn't do really well. Uh, but stay away from processed carbohydrates. I've always had a low insulin. I can keep it down. So you want to eat low glycemic foods if you can't do that. But ketosis is very reasonable. And if you're in ketosis, that's when you give the treatment, whatever repurposed drug it is. And I think that's very sound approach from there. So diet is very important. Getting some physical activity is important. And then I believe in the mind body. I've spent a lot of time doing the work of Dr. Joe Dispenza. Uh, and, he believes that, and I believe too, that all illness comes from an imbalance of energy and frequency. Everything is energy and frequency. We can see some, but we can't see a lot of it. And so what you put in your mind and what you project out there is not just a thought. It is energy and frequency. And if we stay in a negative framework of mind or a stress framework of mind, those 60 or 70,000 thoughts a day that we produce are going to go out. And 95% of what we do the next day, I think the next day, are those thoughts. So we're not going anywhere. So mind body, Dr. Joe Dispenza's work, I think, is critical. I've sat next to cancer patients who've cured themselves, brain tumor, seen breast cancer, metastatic breast cancer on stage several times, 3 or 4 times actually. So I know it's real. So anyway, my name's Kirk Hamilton. One message I would say is just don't get any more vaccines, especially COVID vaccines, mRNA vaccines. The work by RFK soon. I think right now we're going to get it's not going to be recommended for children and pregnant mothers. And when that happens, the whole house of cards, hopefully it will go. But until that time, stay and be well. And I'll talk to you soon.